Hi there, in this video I'm going to show you some simple home remedies that you can use to bacterial vaginosis. These remedies are all natural and easy to follow, so stick around and I'll show them to you right now. Top 3 Bacterial Vaginosis Home Remedies. VV. Complex colony of bacteria lives in the human vagina and can aid to maintain healthy vaginal and sexual health. Many of these bacteria are members of the Lactobacillus family 1, which aids in the competition with and prevention of the growth of pathogenic bacteria. A healthy vagina should not have a fishy odor, but harmful microorganisms like Bacterial Vaginosis can overpower the typical Lactobacillus population and create bacterial vaginosis, which causes a fishy stench. Let's examine more closely at bacterial vaginosis, its symptoms, and some home cures for treating it. What is the cause of bacterial vaginosis? Anything that alters the pH of your vagina or disturbs the usual vaginal flora might cause harmful bacteria numbers to rise and lead to bacterial vaginosis. The following factors can enhance your chances of having BV. Douching is the washing of the vagina. The pH of water is approximately 7, but the pH of the typically acidic vagina is 3 to 4. Douching takes out natural bacteria and produces variations in the bacterial and pH balance of your vagina. Douching is unnecessary since vaginas self-clean. As previously said, avoid using strongly scented items or harsh washes on your vagina. These can irritate your vaginal lining and cause pH imbalances. And it cannot be overstated, avoid douching. Unsanitary practices. Tampons are put into the vagina and can allow bacteria to thrive. Tampons that have been left in the vagina for an extended period of time can promote the growth of E. coli bacteria that cause urinary tract infection, UTI. If tampons are left in the vagina for an extended period of time, E. coli can grow and begin releasing substances that induce toxic shock syndrome, which causes low blood pressure, fever, peeling skin, and rash. Unsafe sexual behavior. Both receptive, oral cunnilingus 9 and male-female intercourse can raise the risk of BV. Bacterial vaginosis is not necessarily a sexually transmitted disease, meaning that someone with bacterial vaginosis cannot definitely spread it to a sexual partner, although having intercourse with a new partner or having several sexual partners has been linked to an increased risk of bacterial vaginosis. Women who have intercourse with other women, on the other hand, can spread BV to their partners through vaginal secretions. 11. Because the causes of vaginal odor differ, see your doctor if the smell persists. An underlying medical condition could be causing the vaginal odor. Bacterial cultures can be used to diagnose bacterial vaginosis, and your doctor may recommend the following excellent practices in addition to medications such as metronidazole gel. Regular bathing with a fragrance-free, natural soap is essential for keeping your vagina smelling fresh. Avoid perfumed soaps, gels, and antiseptics, which can alter your vaginal pH and disrupt the natural balance of healthy flora. Restroom etiquette. It is also critical to wipe properly after using the restroom. That involves wiping from front to back to avoid getting fecal particles and associated bacteria into your vagina. Water-based lubrication. If you're going to use lube during sex, go for a water-based product. Underwear. Change your underwear on a regular basis, and choose natural materials such as cotton or silk over synthetics. Natural materials breathe well, and microorganisms are less prone to proliferate. Hydrogen peroxide is a common ingredient in household cleansers. Certain vaginal probiotics have been proven to create hydrogen peroxide, which may aid in the destruction of harmful bacteria and the regulation of vaginal microflora imbalances. The use of hydrogen peroxide may aid in the reduction of bacterial vaginosis. Researchers examined the efficacy of vaginal douching with hydrogen peroxide and an oral dose of metronidazole in one trial, an antibiotic commonly prescribed for bacterial vaginosis. The randomized trial divided 142 BV patients into two groups. One group received a douche of 20 milliliters of 3% hydrogen peroxide and an oral placebo. The other group was given 2 grams of metronidazole orally and a placebo douche. The hydrogen peroxide group cured at 62.5%, while the metronidazole group cured at 78.6%. Metronidazole caused more gastrointestinal side effects. This shows that hydrogen peroxide douching may be useful in decreasing bacterial vaginosis. 16. However, as previously said, douching frequently contributes to bacterial vaginosis, and studies suggest that stopping douching can considerably reduce bacterial vaginosis occurrences. Douching with any chemical or cleanser is not recommended if you do not have BV. 17. 2. Tea tree essential oil. Tea tree oil has natural antibacterial and antifungal characteristics that may assist to decrease or prevent bacterial vaginosis. According to research, bacteria linked with bacterial vaginosis are especially vulnerable to tea tree oil, whereas naturally occurring Lactobacillus species are nearly twice as resistant. This shows that tea tree oil may aid in the restoration of vaginal flora equilibrium. 20. If you do use tea tree oil, keep in mind that it is extremely potent on its own and should be diluted with a neutral carrier oil before applying it to the vagina. Undiluted tea tree oil will aggravate irritation and burning. One doctor reported a verified case of BV that was self-treated with a 5-day course of tea tree oil pessaries comprising 200 milligrams of diluted tea tree oil in a vegetable oil base. The woman's BV was resolved as a result of the medication, and the doctor considered that tea tree oil should be investigated as a treatment for BV. 22. Garlic tablets. 3. Garlic has potent antibacterial qualities that may help to reduce bacterial vaginosis and promote vaginal health. Researchers compared the effects of an oral garlic tablet to an oral dosage of metronidazole in the treatment of bacterial vaginosis in one trial. According to the findings of this study, the garlic tablet was comparable to the antibiotic in terms of efficiently lowering indications of bacterial vaginosis while causing considerably fewer negative effects. This shows that garlic supplementation could be a viable option. 20. Consider adding garlic to your diet or taking a garlic supplement. However, do not insert garlic cloves into your vagina, since this might cause discomfort and other health problems. Because BV is caused by dysbiosis, or vaginal flora imbalance, Restoring normal vaginal flora is beneficial in the treatment of BV. Consuming live Lactobacillus acidophilus cultures in yogurt improves the amount of L. acidophilus found in the vagina and lowers BV episodes after 1 and 2 months compared to women who consumed sterilized and pasteurized yogurt 10. Another study discovered that intravaginal yogurt application was more effective than intravaginal vinegar tampons and no treatment in pregnant women with BV. Vaginal health foods. Eating the correct foods may help to improve your overall vaginal health and prevent bacterial vaginosis infection. According to one study, regular consumption of probiotic-containing yogurt helps reduce the prevalence of bacterial vaginosis when compared to a pasteurized control yogurt without probiotics. 10. The following tips will help you maintain the best gut and vaginal bacteria possible.